The COVID-19 pandemic has spread to nearly every corner of the world. The UN says the fight against the virus must be just as widespread. The World Health Organization's COVID-19 Strategic Preparedness and Response Plan has so far raised $1 billion and another $145 million has been pledged by countries, charities and private companies. But it's estimated nearly another $900 million is still needed. The UN says the money is being used in the world's poorest countries to stop the spread of the virus, as well as the spread of misinformation, reduce mortality rates and increase access to vaccines. And analysts say the UN's footprint across the world makes it best placed to deal with the pandemic.
The UN has with its blue helmets, whether it's in Central African Republic, Democratic Republic of Congo, Mali, and elsewhere, it does have the sort of infrastructure in place that can help distribute vaccines once they become available.
The UN has been heavily engaged in the delivery of COVID-19 vaccines through the COVAX global vaccine programme, aiming to ensure low-income countries aren't left behind in the fight against the virus. So far, more than 278 million jabs have been delivered to 141 countries. The US has been the biggest donor of vaccines, contributing more than 129 million, with China the second largest, donating more than 41 million doses. UNICEF is helping to transport both vaccines and the infrastructure needed to store them. They say huge progress has been made, but while the vaccine rollout in several countries is now so advanced they've begun giving people booster shots, those less well off are being left behind.
The latest estimates suggest around 1.8% of people in lower income countries have received just their first dose. And of course, in higher income countries, those upper middle and high income countries, it's above 80%. COVAX and lower income countries tend to be at the back of the queue, the back of the line with manufacturers, either with higher paying customers in high income countries really at the front.
Agencies like UNICEF are looking for world leaders to make renewed commitments to supporting the equal distribution of vaccines when they appear at the General Assembly.
This won't be brought under control until we have equitable distribution of all of those supplies. And so, I know it's been said many times, but this is not going to be over until everyone is safe and protected.
But with the pandemic now well into its second year and a number of other pressing issues grabbing the headlines, such as the situation in Afghanistan, COVID-19 may not be everyone's priority.
COVID-19 will still come up, and I'm sure it'll be referenced by most of the world leaders, but maybe it'll be sort of point 6 or 7 in their list of talking points rather than point 1 or 2 as it was last year.
The UN Secretary General says tackling the pandemic is a joint challenge, and he hopes the high-level debate will lead to a global vaccination plan that will be implemented by an emergency task force made up of vaccine-producing countries, the WHO, and international financial institutions. Sarah Walton, CGTN, New York.